So I would introduce this as JaneMurkin. We're very pleased to have you talking at our event. And Jane is the Deputy Director of Safety and Improvement and Nursing in the NHS. So we're really pleased to have you here. So over to you.
Excellent. Thank you very much, Leslie. And good morning, colleagues. Thank you for inviting me along today. I do have some slides to share. I just need to see how to do that, whether you need to do it your end or whether I can do it. So bear with me, colleagues. And it's a great opportunity to come and talk to you today about the work that we're doing in relation to improving nutrition and hydration care. So I'm just going to see if I can share my screen. Can you see my slides now?
Yes, it just needs to go in slideshow mode.
Wonderful. Thank you very much for bearing with me. Lovely. So what I thought I'd do, colleagues, is just give a little bit of an overview on the work that we're doing in NHS England. And as Leslie said, I work in the National Nursing Directorate for the Chief Nurse. My portfolio is around Deputy Director of Safety and Improvement. And talk a little bit, I think, about the challenges that I'm sure you are all very familiar with in relation to nutrition and hydration and making sure that people have sufficient dietary and nutritional needs met whilst they're in care or healthcare services. A little bit about the opportunities we have and just set out the work that we're doing to refresh national policy and think about what more we can do to support providers, staff, professionals, and of course people, and more importantly that become patients and come into our services to ensure that they get the best standards of care in relation to nutrition and hydration. And just a little bit of a story. So my dad died 2 years ago. Sadly, he was quite an elderly gentleman with lots of comorbidities and health challenges. But in the last 18 months of his life, he had liver cancer and liver failure, and he had a condition called ascites, where build-up of fluid. And so he used to go into hospital quite regularly to have the fluid drained off. And my dad only really drank lime cordial in the last 6 months of his life. But of course, when he went into hospital, they continued to put a jug of water in front of him and wonder why he never drank it. And so I suppose for me, it was a stark opportunity to understand the reality of actually somebody's very fundamental needs to be hydrated and kept hydrated when they're in hospital. If we don't really understand their preferences and their likes and dislikes, and we don't have a service that enables them to access lime cordial or to now allow people to bring that lime cordial in for him, then people aren't really going to have their nutritional and hydrational needs met. And so I just thought I'd share that personal story and experience with you. So I think in terms of background and context, you'll all be very aware of this, but certainly working in partnership with the National Patient Safety Team, asking them to look at the incidents related to nutrition and hydration of people in hospital. This data is about 2 years old now, but there were 4,290 events in relation to people not getting adequate hydrational needs. So they were either overhydrated, given too much fluid, or clearly underhydrated. And that's quite significant, isn't it? There was a report published by Hogan in 2012 and then refreshed in 2015. And those studies from Hogan's work talked about 13% of deaths were associated with problems in the management of fluid for people when they were in care services. We know, sadly, from CQC inspection findings and published reports, and certainly here you can see on the slide inpatient survey data and complaints data that tells us we're still not getting it right for people when they're coming into our health services or they're being cared for in a care home or residential environment. So real opportunity for improvement. I think it's also important to look at things on a kind of national but also a global platform. And, you know, the World Health Organization do talk a lot about the importance of nutrition to delivering the best outcomes, but more importantly, that it's a developmental, an economic, a social and medical impacts of the burden of malnutrition and how lasting this is. And of course, the context in other countries may be different in terms of the people that live there and the challenges that they have in terms of accessing sufficient nutrition and hydration. But actually, there's a lot of commonality. And so we can learn a lot from the work of the World Health Organization to think about how does that resonate and fit within our context. So why do we need a national nutrition and hydration policy? I suppose you don't need me to tell you it's absolutely fundamental to the delivery of high quality care. And it's fair to say that the commissioning excellent nutrition and hydration guidance that was published in 2015-18 is clearly out of date. And so thought it would be really important for us to refresh this, but take this as an opportunity to co-design and develop that with key stakeholders and think about really what's changed in that time, because clearly there's been a lot of changes, both in terms of national policy and drivers, but also there's probably some things that are very still similar. And so this policy is intended to make sure it absolutely references all the evidence-based best practice, all the national guidance and standards, and make that more contemporaneous. So that's the work that we have been taking forward. And I'll touch a little bit more on that and some opportunities that you might be able to support us with as we start an engagement process on that draft policy. Again, just some of the sort of national strategic drivers. And again, I'm sure you're all very familiar. I mean, the Constitution talks about patients have the right to suitable and nutritious food and hydration. We've got the long-term plan, and then more latterly, we've had the Darcy review that has talked about some of the challenges in relation to the quality of care across our healthcare services. And so that, again, could provide an opportunity for us to think about, you know, what else do we need to do in this space? We've obviously got CQC regulations, and in October 22, under my boss's leadership, she's Charlotte McCardle, the Deputy Chief Nursing Officer for the country, we set out a plan really to address some of these challenges around nutrition and hydration. And so we established a National Advisory Board in June 23. Myself and a regional chief nurse co-chair that, and we've got a lot of key stakeholders on that group that are helping us to think through what we need to do collectively to make things better for people. There are a lot of national standards, guidance and regulatory requirements, and these are some of them that I've set out here. And I suppose our reflection at the advisory board level is, if we've got all of these, why are we still not getting it right for people? You know, what's the gap actually? Because we've got a lot of regulation and guidance that tells us what we should be doing, but clearly there's a gap around implementation. And I'll touch a little bit on that as well in a few moments. Thank you. I think sustainability now is an agenda that maybe back in the commissioning guidance days wasn't really in the spotlight, but actually we know the food system can absolutely mitigate the impact of climate change. And so we've been very thoughtful in the refresh of this policy that we really absolutely need to think about how we minimise food waste. I mean, there's already been some sort of national drivers around that, but more importantly, what more can we do to minimise single-use material that's associated with nutrition and hydration, but also look at the opportunity here to go some way to contribute to that bigger agenda around climate change that's clearly quite significant for us in our society. And again, listening to the World Health Organization talk about this and other colleagues nationally, it is one of the big safety issues for us today. So our vision really for this new policy is about making sure we can provide people, patients, visitors, staff with, more importantly, high quality and nutritious food and drink and or artificial nutrition when they're in healthcare settings. I'm thinking about it from the lens of staff, and before I came into work in Ruth's team 3 years ago, I worked as a chief nurse in a provider land and was quite struck, both pre-pandemic actually, and of course during the pandemic, how often nurses and other members of the multidisciplinary team are so busy delivering care and often in conditions that aren't always as conducive as they should be. Actually, how often do they get the time to have a drink? And there were some great initiatives that we hear about that are going on across the country. Tea for Two would be one, you know, where nurses and patients people receiving care are sitting together to have a cup of tea. And I think that's important too, to think about the social aspects of this. You know, food, drink is a very social thing in our society, isn't it? And for many of us, more so depending on our culture and our background. But actually, how do we think about that in the context of delivering healthcare services? And we've also progressed a piece of work around improving fluid management. and that came off the back of the data that I mentioned earlier. We also had, or the chief nurse at the time, Ruth May, had received a letter from the Association of Nephrology Nurses, and they had undertaken a survey across the country, and that survey had identified actually some real gaps in terms of practice and policy. And so we used that and the patient safety data that I mentioned to look at a diagnostic programme of work. We established a short life working group. We had experts in the field, nurses, doctors, researchers, people with lived experience, to really think about how do we co-design and develop a proposal to really focus on improvement. Because actually across the country, we hear too often about lots of great ideas, examples of best practice, but how do we make sure that they are shared, understood, known, and scaled up across the country? And so we spent some time over probably about 8 months developing a plan and an improvement proposal, and working as well in partnership with colleagues who are doing a lot of work around acute kidney injury, because again, lots of common issues that we can work together in to address. And in fact, tomorrow I'm presenting at the Hydration Health Summit in the morning, opening the event and then supporting them with a panel discussion. So there is lots of good work going on. We just need to really make sure we're able to collectively ensure that we're addressing the challenges for people, patients in our health and care system in relation to nutrition and hydration. And we're going back to the point about we've got lots of standards, we've got lots of best practice, we've got lots of regulation. I think it's fair to say that our gap is probably implementation. And so the National Advisory Board, overseeing the work on the refresh of the policy, commissioned a short life working group, and that's a subgroup really of the board, to look at, you know, what do we need to do to develop a best practice guide that's easy for then providers or ICBs to take and say, well, actually, we've got a problem with X or Y. I can see that Trust A or B has done this and they've addressed the issues. How do we now take that forward? So really recognising limitations of policies, because policies are very important, but actually there's a gap between the policy and best practice and what goes on across our health and care system. So really wanting to make it easy for people. And if you're a nurse in a ward and you've got a challenge in relation to making sure people have their, protected meal times, who's cracked that elsewhere that you can learn from? And then, as I mentioned earlier, we're just about to commence a engagement phase of work on the national nutrition and hydration policy that we've refreshed over the last year. I'm really keen to engage with people like yourselves and as many other stakeholders as possible to just make sure this policy is going to be fit for purpose and actually is incorporating all the really important things we know about meeting the nutrition and hydration needs of people and ensuring that we absolutely do bridge that gap between current state and best practice. So that's a bit of a whistle-stop tour from me, Leslie, and I hope that that was helpful for colleagues. And I'm really happy to answer any questions as well. Thank you.
Great. I think that will be very helpful for an awful lot of people. And we, particularly on the MTF, will be keeping a very close eye on the national policy and how that's panning out. And hopefully we can have put our four penneth in as well.
I think that would be fantastic, Leslie. Yeah, fantastic.
Stakeholders. I don't know if there's any questions. I don't know how we do that, but I think it's best if people email you, perhaps.
Absolutely.
Happy with that.
Of course, Leslie. Yes, absolutely. And it would be good maybe, Leslie, to come back to you and think about, in terms of engaging on that policy, how might we best do it?
Yeah.
Do we want to facilitate another discussion? Do we want you to, to send you, because we've got some slides, or send you the actual draft copy and you and colleagues have an opportunity to review it? Pretty flexible about the approach we take, but would really value actually yourselves and colleagues, fresh eyes on it and give us some feedback.
Well, I'm sure that we'd be all delighted to have a look at that. And thank you so much. And I will see you at the hydration event tomorrow.
Lovely.
On Thursday, which is, just a great day for the UK Malnutrition Awareness Week.
Wonderful. Look forward to seeing you in person, Leslie. Thank you very much, colleagues. Lovely to meet you.
Bye-bye.
Bye.